much for joining us at our first Second Wednesday Safety Session of 2024. My name is Carlos Carrillo. I'm the Executive Director of the South Florida chapter of the Associated General Contractors of America. This is one of my favorite things to do each month. The safety community here in South Florida is incredible, and we're very blessed to be able to do this via Zoom, which allows our safety members in Orlando and Tampa to also take part in these meetings. You gonna take care of that speaker? Thank you so much. So for those of you that are joining us online, hopefully you can come in. We got a great breakfast here, courtesy of our sponsors. And it's always great to come in and do some networking beforehand and share some best practices, share what's going on in the field, and talk to your colleagues. Want to start off by thanking our sponsors, Milwaukee Tools. Milwaukee is an incredible sponsor. They sponsor these events throughout the year. They're also major sponsors of our other events that we do outside of safety, such as our awards program, which are coming up on Friday and celebrate the best projects that our members have built. Also want to say thank you to Kelly Cronenberg. Kelly Cronenberg has been an incredible partner for us, hosting these safety sessions here, the cafe, the meeting rooms, having folks like Andrea and Cedric here to assist us. It's always really beneficial to us. So thank you all for being part of that. Thanks, man. They give you applause. I love it. You guys don't give me applause, but you know, it's okay. We can work on that later. So thank you all very much for being here, and thanks to our sponsor. I also want to thank, very important, the members of our safety committee and our members of our professional community that ship in. I want to say thank you to all of you for being part of this, for helping us find guests and select topics. We just had a meeting with some of the senior members of the group, and we're going to be sending out a survey to you all next week. Please take a look at the survey. Take your time to think about what your answers are going to be. You're going to help us craft what sessions we're going to be looking at towards the future, what these meetings are going to look like. So, you know, you're going to help guide us. So please take your time, fill out that survey, and get it back to us in a timely manner. That being said, we got a great session for you all to kick off the year. After I will go to who we're going to be having coming up. Sorry, guys. We'll be hearing from Gus Gutierrez, who will be talking about back safety on the job site and in construction. Yes, you're going to hear lift with your legs, but there's a lot more to the presentation than that. Hopefully, you all asked a lot of questions and get some good answers out of Gus. Gus is I won't say how many years, but he is a seasoned professional in the field, and I'm really looking forward to hearing what he has to say. But we're going to kick things off with two very good friends of our organization, members of the safety and health team at AGC of America. And let me tell you, being part of a group and having AGC of America at our back is an incredible benefit that you all have as members. I'm going to turn things over to the great Nazia Shah and Kevin Cannon. Nazia, you are the Director of Safety and Health, correct? That is your title?
Correct.
And Kevin is the Senior Director of Safety and Health, right?
Safety, health, and risk management. Currently.
Yeah, they've thrown risk management on
because
that.
he's older.
Yeah.
There you go.
I went to great lengths to set up that joke. It wasn't that great of a payoff, but I'm going to turn things over to you all. Thank you all very much.
All right. Thank you, Carlos. And again, thank you to the committee for the invitation. We always enjoy, participating in these meetings and, giving an update, from our, from our space, from the things we do on the policy advocacy side, as well as the programs and services. As Carlos said, I'm Kevin Cannon. I am the Senior Director of Safety, Health, and Risk Management, and my colleague Nazia Shah, the Director of Safety and Health Services. And, we work very closely within the department. We're small but mighty. We're 2/3 of the department. Our colleague Marsal also assists us in all the things we do. I primarily deal with policy issues Whereas Nausea, she handles a lot of our programs and services, you know, the conferences, education programs, recognition programs. You know, we too want to thank Milwaukee for the support that they give us, you know, across AGC, but specifically, you know, the things that we do in the safety and health space. Nausea, we didn't build out any slides on those programs, but she is going to pitch them during her portion. And I know we have 20 minutes and a lot of slides to get through. So we'll get right into it. You know, once we transition to Nausea, she can talk a little bit more about what she does. But, you know, for the sake of time, we want to make sure that we cover everything. Again, it might be brief, but you know, at least you'll have this information available to you. We're going to share the slides with Carlos, and he can distribute to those, excuse me, in attendance, you know, in person as well as virtually. So we're going to go over some of the things that OSHA is working on the regulatory front, but also talk about some of their policy initiatives. And then I'll close it out with just a little bit, you know, a quick review of the latest inspection figures, as well as what you know, the BLS report from December showed in as far as the number of fatalities in the construction industry. And then Nausea, again, will close it out with one of the things that we're doing that I think is super important is our efforts on the mental health and suicide prevention side, as well as some of our new, well, maybe not so new, but a new delivery method for our safety management training courses. So I'll get right into it. You saw the fall 2023 agenda. You know, OSHA puts out a regulatory agenda 2 times per year, a spring and a fall. Generally, they look very similar to one another. They don't move you know, at the fastest pace when they're getting through the rulemaking process. So, you know, I'll start with, and again, if you look at the reg agenda, there are a lot of items on there, but we're going to just touch on the ones that I think are, you know, I guess during, you know, at the final stages of the rulemaking process. So just real quick on the heat prevention standard. I know we've talked about this before during our visits, but we've moved a little bit further in the rulemaking process. You know, I'll just focus on that very bottom bullet, which is September 7th through 8th, 2023. OSHA convened what's called a Sabrifa panel. Whenever they do a rulemaking that's going to have a significant economic impact on a substantial number of small businesses, they have to put together what they call a panel. And the panel consists of the Office of Information and Regulatory Affairs, OSHA, as well as the Small Business Administration. And there are only 3 agencies that are required to do this, OSHA being one, the other EPA, and one is focused on the, you know, financial sector. I can't remember that new agency that was created some years ago, but anyhow, what they do is they bring together a bunch of small employers, and given the scope of this rule, it was a very diverse group. You had everyone from golf course maintenance to foundries to construction to agriculture. And what OSHA did was put together what they say is their regulatory framework, where they presented options for regulating heat in the workplace. And again, the scope is very broad. Again, they're covering everything from bakeries to cleaners to agriculture to construction. And so, unlike you know, when they put out a proposal, they said, "Hey, this is what we're thinking," and they gave various options and asked these small business representatives to kind of weigh in on, you know, what they think would be practical and what they thought was unnecessary. Some of the things that I'll highlight that came out of it. Well, first I'll say that, you know, we did put 3 contractor members forward to participate in the process. One was a heavy highway utility contractor out of South Dakota. One was a concrete sawing and drilling contractor out of Houston, and the other was a GC out of Houston. And, you know, for construction, you know, it's a dollar threshold amount. And so, you know, it's I think the figure is 47 mil for GCs and 19 for specialty. So again, you know, on the very smaller side, but They were very candid in what worked, what wouldn't work. Some of the highlights again that I'll go back to was on the documentation side, OSHA had proposed that two things. One was maintaining a log of daily temperatures. There was some pushback on that because of the internet. There's no need to make a daily log of the temperatures when you can just go back and Google using weathers.com or whatever, the National Weather Service, whatever providers out there, you can go back and look at the history of the temperatures. The other was the prescribed breaks. 1 hour, 15 minutes every 2 hours at the low side of the temperature threshold at 80. Once you got to the high temperature trigger, it would have been 15 minutes every hour. There was a lot of pushback on it. Extra documentation that would have been required would have been maintaining a first aid log separate from your 300 log. And we felt like, that would have caused confusion and maybe even exposed some contractors to somewhat of a debate with a compliance officer who may have felt like, a first aid entry on the log should have been elevated to on the first aid log should have been elevated to an official entry on your 300 log. Let's see, buddy system also was a big issue, especially for the small employers who operate with one-man crews. So, those are some of the things that were put out. One of the things, and once they complete this process, that panel that I mentioned of the 3 agencies, they have to put forth a report, and they put forth a final report. And, the common theme was flexibility. Understand that there's no way that one rule can take into account, all of the unique aspects of the various industry sectors that are being regulated. So flexibility was a key. Keeping it simple. Also, OSHA should and I think it's important that they take into account the what we call personal risk factors, lifestyle choices, as well as pre-existing medical conditions. So those are some of the things that were discussed during these 6 calls, which we participated in. And the reason this is here, the SABREFA really signals early stages of the rulemaking process, but as I understand it, they have committed to completing a heat standard by the end of 2024. So we'll continue to engage and monitor as they move through the rulemaking process. PPE in construction, very simple, straightforward. They want to revise the language in the PPE standard to explicitly call out fit to match what's in general industry and maritime. Of course, we have no issue with the concept of proper fit in PPE. We understand that fit is important if we want the equipment to provide the level of protection it's designed to, but it's the subjective nature of, how a compliance officer might define fit and how it will be enforced. Some of the examples, or at least one of the examples that got our attention in the notice of proposed rulemaking was citations that were issued in the construction industry, related to gloves. And it says, the employer was cited because the gloves were too large and reduced the dexterity of the employee. We're not for certain what type of work this individual was doing, but, trying to understand what additional hazard. We understand, the additional strain that could be put on the hands and wrists with larger gloves, but does that warrant a citation? So that's one where we've been engaged in, and understanding that this is one too that they plan to get done by the end of 2024. And walk around, this is one that we really are concerned about. And again, this is in the final stages of the rulemaking process. For those that are familiar with how the standards are promulgated or regulations, it goes through the notice and comment period. Once that closes, OSHA sends it over to the Office of Management and Budget. They look at it, and it's really, formality in some cases where they just say, okay, you've satisfied all the requirements. You know, they look at the cost benefit analysis, which there was none with this one. So it's over there now. It went over on Friday, so we'll see this pretty soon. And I think they're aiming to get this out by.
This is a big one, guys.
Yep,
Big
it-
one.
yes, sir. And really, you know, the current rule says that you know, the employee representative has to be or must be an employee of the employer. However, you know, I can't remember exactly how long ago, but they there it is, it's at the top of the thing. You know, 2013 received a letter from a union rep saying, hey, you know, can I serve as the, for the purposes of the OSHA, can I serve as the employee representative at a facility or in a location that does not have a collective bargaining agreement? And, you know, the same letter asked if that same individual asked if a union rep could serve as the employee representative during the walk around portion of the physical job site inspection. OSHA said yes in both cases. And this was not done by way of rulemaking, but a letter of interpretation. They were sued, rescinded it, and here we are. They want to make it official through the rulemaking process. And you know, it goes beyond just union representation at a non-union work site. They call out community activists, special interest groups such as worker advocacy groups, you know, just anybody that's not affiliated with the project. And you know, if at least one employee says, hey, I want Kevin, you know, the OSHA compliance officer must consider it. You know, the concerns we have are, you know, one, you know, who's going to determine the qualifications or the expertise of this individual, who's going to control the type of engagement that he or she has when they're walking the job site. It could, you know, result in disputes between this individual and the compliance officer, whereas he challenges the compliance officer for the lack of a citation being issued. And then, you know, how ingrained in the process can this person be? You know, are they privy to the pardon me, are they privy to the employee interviews? Are they allowed to have access to medical records or air monitoring records related to that employee? So, and then, you know, it brings up a property rights issue. You know, a lot of times, at least in the construction industry, you know, we may not be the owners of that project per se. And so we can't just give free access to the job site just because this individual wants to involve themselves in the inspection portion. We do plan to meet with OIRA along with our coalition members to raise these concerns further. Improved tracking of workplace injuries and illnesses. This applies to those who have employed 100 or more employees in the prior calendar year. So that means 2023. And, you know, this is somewhat of a volley. Back in 2016, this rule was finalized and the threshold was 250. During the last administration, they said, we don't need all that detailed information. You know, just a 300A is sufficient. And that's where we were up until January of this year. So from January 2nd to March 2nd, employers with 100 or more to submit the 300 log 301s as well as 300A. And this information is going to be made available on OSHA's website, which is concerning to us. It allows, you know, Joe Public to make an assumption about your safety and health programs with very little background or context. And these are just some of the numbers we gathered from OSHA as far as what the submissions have looked like over the years. We anticipate this number going up. COVID-19 and healthcare, just real quick. This is one on, if you look at the reg agenda, it was due to be finalized in December 2023. It is not yet, you know, hit the Federal Register, so not sure when we'll see it. But given that they've indicated it will be finalized, we anticipate seeing it soon. And basically, this is a requirement for, you know, there were two options that were put forward. A new standard, or just, as I say, you know, very similar to the confined space or lockout tagout standard, where the contractor has some, discussion and coordination with the host employer to figure out, are there, is there a potential for exposure? What are you doing, healthcare facility or host employer? And we'll devise a plan accordingly. The other option would have required contractors to pretty much engage in the same efforts that we or policies that we put in place very early in the pandemic, where it was temperature checks, disinfecting, social distance and whatnot. So we think this is the lesser of the two evil, the less pain of the two. So I'm not sure what it'll look like when we see the final rule, but the recommendation was to follow option one. And I'm not sure if anyone in the room falls or may fall under MSHA jurisdiction at some point in time. But MSHA put out their proposed standard to revise their silica rule in July. We participated in that rulemaking process, and in fact, we're meeting with OIRA tomorrow with the coalition. The biggest concerns is that for contractors who perform work, operate quarries and such, they are treating both underground mines and surface mines the same. Some of the other issues are the I don't want to call them conflicts, but the lack of alignment with the OSHA standard. There's no option for rotation as an administrative control. There's no table one option. What else? Respirators are only to be used on a limited basis. So those are some of the things that we raised as far as those who are, again, operating surface mines and the like. But we also suggested that any, contractor, whether it be a GC or specialty contractors who's performing work at sites that fall under MSHA jurisdiction, that those contractors be allowed to follow, somewhat of an exemption and be allowed to follow the OSHA rule. Some policies, again, the heat NEP that's been in effect since 2022. The heat priority days are 80 degrees. State plans are encouraged to adopt, but not required. Unlike, most NEPs, there's no standard that this is propping up, I'll call it. So that's what's concerning. Again, they put out the list of all the items that compliance officers are to take into consideration, but not really saying what would be satisfactory in their view. And these are just some numbers that we got from OSHA as far as inspections under the NEP. If you look at it, it's been through August of 2023. So probably about 16, 18 months. They conducted nearly 4,000 inspections. I'm sure that number's increased since we got this data. And I'll go back to the heat. We did request, their files on the enforcement. We do have them. We are looking at, what our options are as far going through to learn the types of citations that have been issued because they're using the general duty clause. And as we always say, they could always say you could have done more. Especially in the event of a serious illness or hospitalization or even worse, fatality. Falls NEP, that's been in effect since May. They announced it at the beginning of the stand down week last year. The biggest thing for us on this is that a compliance officer can initiate an inspection just by, simply observing someone working at heights, even if there are no hazards present. Excavations, they refocus their attention on it. You see they have a goal of more than 1,000 trenching inspections. And, because of this, and here's some of the numbers that prompted it. In 2022, there were 39 trench-related fatalities. 2023, they were 10 through 9/1/23, September 1st. And we were on a call the other day, and we understand that there's been one already in the month of January. And because of it, we were approached along with all the other organizations that you see on the screen to join their efforts to raise awareness. And so we have an alliance program Silica enforcement, I know I'm flying through this. You all will have all these slides, but this is another of their emphasis programs. And you can see the total number of inspections since it was launched. And, surprisingly, Table 1 is one of the most cited. We felt like one was an easy compliance tool for contractors, but again, fully and properly implementing controls can be subjective. So we're not sure if that's, one of the areas that we should be concerned about. But there's also the respiratory protection aspect, given the under 4 hours, over 4 hours. And then the OSHA penalty increase, again, goes up every year. So I will just breeze through these. This list really doesn't change much. The only shift I think happened was that aerial lifts leapfrog the 1926-502. And here's some of the fatality numbers. We had 1,069 fatalities in 2022, and you can see the breakdown here as to where the majority of those occurred. And then we have some tables that breaks it down even further by trade or type of work. And then struck bys here. They tell you what, and this is both struck bys and caught in betweens. And it tells you where these incidents are occurring. And hopefully it can help you, or at least us, figure out how we can continue to raise awareness on some of these hazards. And then exposure to electricity, again, running out the focus 4. So I know I was quick, I apologize, but it's a lot of information, a lot of things going on. But we're going to share the slides. You'll have them and always available if you have questions offline. So with that, I'll stop and turn it over to Nazia because I know I went a little over.
That's okay. Kevin, would you mind advancing the slide for
Yes.
me? So, we're on the folks, and Kevin kind of introduced me up front, so I won't reiterate. He's right. I handle our program and services, but we overlap on policy a little bit. So as you all may know, we kind of formalized a national effort as it relates to mental health and suicide prevention in mid-2022. So we're approaching 2 years in. Our first real effort was just establishing a webpage that would have a host of publicly available information that was free, mostly free for the most part, really just kind of consolidating some really helpful information from across the web that we thought would act as a really good starting place for folks that may not be aware of the issue, just looking for resources. And so that website, it's in the notes in this, so don't worry. And I think I have a QR code coming up. So some of the resources you'll find on there are our public service announcements. And this was an effort by AGC of America in combination with our task force, which consists of folks from across the country, just like yourselves, just putting together these stories of real construction professionals who struggled with these issues, in the hope that in seeing these, that folks would know that it would be okay to seek help and that there is help available. We have sample policies, we have like our coins, job site banners, you name it. I think we kind of hit all the points on these. One important thing I want to mention are our quarterly forums. These have been really popular. We've been having them quarterly. And we hit on a range of topics. We'll give you an update on what we're doing as a task force, but we also invite folks in if we feel like they have a good update to share. We've had the SAMHSA on there. We've had a group that was doing research in this area. So we've had the National Safety Council to talk about their efforts. It just really runs the gamut on that. Most recently, for 2024, we've decided that we're going to focus on what we consider to be contributing factors to just mental health and suicide. And so we focused, I'll say, so we already did one for the first quarter of 24. It was on January 24th, and it was on communication. And we're going to continue that trend. I know we have financial well-being coming up. We have one plan for substance use disorders. So you can see a listing of that on the webpage. And again, I'll have the website coming up. We also have a recording of the first forum that we just wrapped up in January. So if you missed that, you can catch it there. You can access it. We have here, we wanted to mention our partnership with U-Turn Health. They offer behavioral health services, whether it's education or coaching. And we actually formalized this agreement just around towards the end of 2023. That link will also be available in the notes section. And Kevin, if you want to advance the slides. And really, like I mentioned, you know, they have a platform where they host a ton of educational resources on these topics, and they also offer coaching for folks who are at risk. So they're basically taking you through the entire process. There'll be a link to that program and what's all available under it. We also signed an agreement with U-Turn Health to help us develop a course for construction supervisors. It's in progress. We hope to have it finalized by the spring, but we're really excited about that. It's broken up into about several modules that we think hit on different topic areas, but will really equip our supervisors with the tools that they need to support their teams in the field. Kevin, do you want to move forward? So that's the QR code. I'll just leave it up for a minute. But again, the link itself will be in the notes section. And everything that I just talked about, which I know is really quick, will be available on that webpage. We have a calendar of events. We have resources that our various chapters have put together. We have our own that we put together. And yeah, I encourage you to just visit. Kevin, you want to advance? So our new online safety and health training courses, if you are familiar with our safety management training course and advanced safety management training course, they've traditionally been in seat, and we offer them, each of them, at least once a year, sometimes twice, just depending on the need and the requests that we receive. So we've taken those online, and really it's still over the course. Both of these are over the course of 3 days. The basic ones handle like more on our focus for just the basic skills that you need to manage your company's safety program. The advanced one is really for folks who've had some time in the industry. They are looking at the legal aspects surrounding safety. They might be diving into crisis management. So some more advanced topic for that advanced safety management training course. They're both 3 days, and they're still going to be 3 days online. The only difference is that we're not going to do back-to-back days. So we're actually in the process of wrapping up the virtual advanced safety management training course right now. And what we did was we did it over the course of 3 Fridays. And we all know how sometimes just sitting in front of a computer for extended periods of time can be very, it can be a lot. And we wanted to recognize that and break it up over the course of 3 weeks, having it on a Friday. Yes, it's all day, but they have ample breaks. There's, similar to in-person, we've built in opportunities for engagement, for discussion. And from what I've seen, you really haven't skipped a beat from between the online to in-person. So we're super excited about it. It's just another way for us to engage with folks out there. So I encourage you. The links are going to be in the notes, and those links will take you to both our online options and our in-person options. Kevin, is there one more slide? Oh, no.
Nope,
All right,
that's
so we're at
it.
the end. Thank you. Thank you so much.
I know we went over and had a lot of time, but you know, as I mentioned, you know, Milwaukee is a great partner of ours. They also support our 2 of our safety award programs that Nausea manages, and that's the Safety Professional of the Year and Safety Champion of the Year. They are not out yet. They'll be coming out later this year, so be on the lookout for that. And we've also just wanted to plug not only our training courses, but the conferences that we hold January, July. The next one is in St. Louis, July
16 through 18.
there. All right. Apologize, Carlos, that we went over, but that is a wrap for us.
High quality information is always welcome. Are you guys okay taking some questions?
Absolutely.
Let's do it. Who's got questions? Cedric, the mics pick them up, right?
Yeah.
So it's working. Go ahead, sir.
You know, you mentioned the injury tracking notification with OSHA. think your wording made it sound, it's not a requirement yet, or is it a requirement going forward?
That is a requirement right now. It went into effect January 2nd.
Okay.
So you have the 2nd through the January 2 through March 2 to submit that information. We have heard from some members that the website was still only asking for your summary, but I believe OSHA has corrected that at this point.
Yeah, and Kevin, I know that they've been hosting a series of webinars also to kind of walk folks through the platform. Carlos, I'll send you that in an email if you want to shoot out that, because actually I think there's one today.
Yeah, there is one today, but they have one next week, I do believe, the 18th or
Or the
something like
28th.
that. 20, or
Yeah,
is it
from-
28?
From the looks of surprise on some of the people's in the audience faces, I will be sure to share that immediately after this. Thank you.
But that's for employers with 100 more employees.
Yeah, yes. Just your employees. It doesn't count the, if you got 100 people on a project, if they're not yours, all of yours, it's all that's on your payroll. Yes, sir.
Questions? Take advantage of this opportunity having Kevin and Nazi here. Questions? I'm gonna make a statement and give people a chance to think. I think you were both aware of what was going on here in Miami-Dade County with the heat ordinance. I don't know if you guys, Lord knows I sent out a lot of emails on it. Miami-Dade County was kind of trying to take the reins and use the heat ordinance as a mechanism to
Yes.
create their own OSHA in Miami-Dade County.
Yes.
When you talk about the accompanying person from outside, be it a union representative or a community activist, this is more for my members. I think you all need to be aware that there's a pretty big likelihood that our current mayor of Miami-Dade County is going to be reelected. And if she does, I promise you something like that or something very similar will be the next initiative that her and her colleagues try and draw up. And that effort was backed by the LIUNA here locally. They're the ones that put the money in for those community groups. And I just want you all to be aware and to stay on your toes when it comes to local policy, reflecting what you see as national policy. So that was just my 2 cents.
No, you're absolutely right. I know there were at some point in time, many years ago, OSHA was trying to reach out to various, leaders of cities such as Miami to deputize building inspectors, to be an extension of OSHA. So, this is just another attempt at, outside influence, I'll call it.
Yeah. And I get accused of trying to scare people, and that's not an accusation. That's really accurate. I do try and scare people. And you all need to be aware in this room, because unfortunately in the state of Florida, politically speaking, Miami it's an interesting, very purple county, but we get a lot of local policy that starts in Miami-Dade County spreads throughout the rest of the state. So we're an important bulwark against what happens throughout the state. Sorry, guys, I didn't mean to pontificate there. Any other questions for Kevin or Nazia? No? Hey, Kevin, Nazia, thank you so much. I'm really excited to promote the online safety courses. We've been getting incredible feedback about AGC's other online courses. And from what I've seen, these safety courses look to be absolutely incredible. So hopefully it gives access to a lot more people that aren't able to travel for these courses to be able to take them online.
Yep, that is the intent. So yeah, any questions that you might have, Carlos has our contact info. And Carlos, if you don't mind, I'm gonna be a fly on the wall and listen to back safety.
Oh, okay. No pressure, Gus. So that's perfect. So, hey, again, thank you to the team from AGC of America. We are very blessed to work with the absolute best group of people at AGC of America in Washington, D.C. What they do, I mean, you got to see what we have from a policy perspective with Kevin, and from what we offer through Nausea. It's incredible. Take advantage. If you need to speak with them, I'm happy to connect you. If you have questions, take advantage of Vanessa and I being able to get you the information that you need. Speaking of information you need, Our next guest, that's a pro level segue, guys. I hope you appreciated that. I would now like to welcome Gus Gutierrez. We're in Miami, so we say Gutierrez, of Healthcare Center of Miami. Enrique Sequeira of our safety committee told me, hey, I got a great guy for you to come out to your safety session. I always love seeing someone vetted by a member of our community come out and speak to us. Gus, as I mentioned before, has a wealth of experience. He's been doing this for quite some time. And Gus, please come on up to the podium. It's yours. Thank you.
Good morning, everyone. Thank you so much, Carlos, for inviting me here today to speak to you folks for a few minutes about some things that are very important. As he mentioned, my name is Gustavo Gutierrez, or Gus. I'm the director of Healthcare Center of Miami. It's an occupational medical center in Medley, Florida. And we provide clients in all industries, especially your industry, with work-related injury care, industry-specific physical examinations, drug and alcohol testing, et cetera, many other miscellaneous tests accordingly. Today, I'm going to touch upon a few topics, some statistics related to injuries in construction, causes for back injuries, how we can prevent them, what are some treatment options, how to better educate ourselves and our employees when it comes to back safety, and then the importance of a provider partner, somebody that you can count on to help you manage safe injuries once they occur. A little bit about myself. I've been in the field of occupational medicine for 28 years now. I'm a physical therapist. I'm the former owner of Healthcare Center of Miami, current director. And as I mentioned, we work with clients to provide the types of services that make sense when it comes to injuries and safety. We all know here in this room that construction can be a very hazardous industry, and there are unfortunately lots of injuries. Some statistics for you guys to sort of digest a little bit. Bureau of Labor Statistics 2021, private construction fatalities in Florida were 76. Half of those roughly were falls, slips, and trips. And the foundation structure and building exterior contractor group accounted for about a third of those fatalities. Non-fatal injuries, which obviously occur at a much greater rate, according to the Center for Construction Research and Training, about 74,500 non-fatal injuries in construction. You see there on the slide the top 5 reported events or exposures, but really the big 3 are contact with objects and equipment, falls, slips, and trips, overexertion, and bodily reaction. So what are some of the common types of non-fatal injuries that we see in our practice and that I'm sure you've seen on your job sites? Obviously, things like sprains, which are mainly an injury of joints and ligaments, strains, which is mostly a muscle or tendinous injury, tears of soft tissue, pain and soreness related to overuse, things like cuts, lacerations, punctures, etc. The CPWR back injuries were and continue to be the most common injury in construction sites. Back in 2010, which is the last time they really tracked this to this degree, it accounted for 16% of all non-fatal injuries on the construction site. So it's obviously a big problem. What are some of the ways that we can prevent injuries? Making our work sites as ergonomic as possible, bringing the work tools and the work materials as close to the worker as possible, storing them close to where they're actually going to be manipulating them, obviously training employees on proper lifting and carrying, educating employees on how to recognize hazardous situations, and then training employees to ask for assistance when needed. Obviously, what can an employee do? Pay attention to the instructions that they're given, pay attention to the education that they're given, and really take responsibility when lifting, making sure that they're keeping the load close to their body, avoiding things like twisting while lifting, moving their whole body, moving their feet, lifting and lowering things rather in a smooth manner, avoiding bending, and of course, wearing proper equipment while they're on the job site. So once injuries occur and they do occur, what do we do? What should we do? And the first and most important thing is that the employee really needs to stop doing the activity that caused the injury in the first place. I can't tell you how many times in practice, when taking a patient's subjective about what happened, we hear, oh, I lifted a heavy object and I felt a really strong, sharp pain, but I didn't think it was anything. And I kept going. And an hour later, I couldn't get up off the floor. Or, I developed pain in my back doing an activity over, an hour, and I just kept going all day and I couldn't get out of bed the next morning. So really educating your employees to sort of stop if they do something that causes, an injury or a significant pain is critically important. And then reporting it to their supervisor. Obviously, the earlier that and the sooner that someone reports an injury to their supervisor, the better outcomes and the better chance of assessing whether or not it's something that is not serious and maybe is a first aid situation, or if it is in fact something that's going to require further medical attention. Ice is everyone's best friend. When an injury occurs, having ice available, I highly suggest it. I get asked all the time, when I get injured, what do I do? Do I use ice? Do I use heat? A new acute injury, you're always going to go with ice. There's an inflammatory process that takes place in the first 24 to 48 hours of an injury, and ice is really going to help to limit that inflammatory process. If you apply heat when an injury first occurs, that's going to send more blood and fluid rushing to the area, and it's going to create an excess of swelling, which is going to result in unnecessary stiffness and pain and dysfunction. So we really want to try and apply ice as early as possible after an injury. And then if the injury does require more advanced medical attention, then certainly make sure that your employee is evaluated and treated at an occupational medical center that you trust. Following up with the employee to making sure that they're following work restrictions if there are any, taking medications, and following instructions are important, really to ensure that you get that employee back to work quickly and safely. And then, of course, following up with the provider, making sure you have open lines of communication with the provider that you're working with to ensure patient compliance. What can we do to educate ourselves and our employees better to A, prevent injuries, and B, manage them once they occur? Well, obviously training. The AGC folks talked a lot about training and safety classes that they offer. OSHA has a lot of free classes as well as ones you can pay for that are really comprehensive as far as ways to help you reduce injuries. And of course, when you train employees, we do see a reduction in injuries. It improves morale. It shows patients that you care. It decreases costs and lost time associated with back injuries. Fall prevention training, implementing systems that really help to prevent falls at the work site. Fall protection, the proper use of personal protective equipment. Posture and body mechanics training. Most folks have never had formal training on how to properly lift things, and you'd be surprised at how just some basic instruction on the proper posture and body mechanics for lifting, standing, moving really makes a significant difference in helping protect your folks as far as back injuries are concerned. Proper lifting technique, as I mentioned, as Carlos alluded to, bending your knees, keeping your back in a neutral position, and lifting, lowering, and raising your body in a steady motion whenever you're lifting. And then promoting a healthy lifestyle. Things like diet, weight control, stretching, and exercise all contribute to a worker's general health, but they also contribute to their back health. We have a lot of clients that partner with their health insurance carrier to do things like a yearly wellness class, or sometimes more than once a year, where you can do basic screenings like blood pressure, heart rate, body mass index, and screen your employees so that they get some information that they might not even be aware of. And then it'll prompt them to go see their private physician and address something that, if left unchecked, can create a hazard in the workplace and result in some of the injuries that we've described. Just some graphics on some of the things that I've been going over regarding, equipment, safety. Do not lift like the person in the third picture, obviously. Provider partner. So it's critically important, because we know injuries are going to occur and because we know how challenging managing your work injuries are, that you partner with a provider that really knows what they're doing and that really understands the importance of communication. At a minimum, you want to expect quality and accessible care from whoever the provider you're using is. And you want to make sure that they're doing a comprehensive evaluation of your employee's injury. So a detailed history is of critical importance to know exactly what the mechanism of injury was, a physical examination, diagnostic testing such as an X-ray. You know, the work comp physicians, one of the most important decisions they make when they evaluate someone is trying to determine whether or not the symptoms that person is displaying is due to a pre-existing condition or is it due mostly to the injury that occurred. So the appropriate diagnostics, a proper diagnosis, a treatment plan that really addresses what the objective findings are and what the dysfunction is, work restrictions if necessary that are specific to that person's job description, and then the ability to properly manage referrals for diagnostics and specialists as needed. And then, of course, case management. Just as important is the case management that you're receiving from your provider partner, making sure that, you know, the clinic's injury care coordinator communicates with all stakeholders, with yourself, with the employee, with the insurance carrier, making sure that you're getting that DWC 25, which I'm sure most of you are familiar with. It's that 2-page state of Florida snapshot that really tells you what happened with that injured person at that visit. You know, what are the job restrictions, if any? When's their next appointment? Has there been a referral, et cetera? Getting that in visit notes to the case manager and the adjuster, notifying you if there's been any change in patient status. Has there been a referral? Are they being discharged at MMI? And then, you know, following up with the actual employee to ensure compliance. As you can see from sort of the basic stuff that I discussed, you know, this industry, injuries are going to happen, right? And what we do, how we act upon those injuries once they do happen, what we implement to help prevent them, and, you know, who we partner with to make sure that, you know, we have the proper professional assistance to manage them, it makes a significant difference. So I thank you very much. I hope that you found this information helpful. And I'm happy to answer any questions that anybody has at this time about this or anything related to occupational medicine.
Oh, awesome.
So, you know, early, you know, in our experiences, we always collected that medical release form when that worker got hurt, right? But as, you know, as we're progressing forward, general contractors, we're not really involved in a work comp claim because, you know, we're doing these CSIPs and OSIPs that separate their claims from our claims, right? You know,
Sure.
It's still best practice to collect that form, even though that worker and that metric is still lives with the worker's employer, or
Which form was that again? I'm sorry, I couldn't hear you.
the medical release form as that worker is released from the clinic.
You
Should
mean
the general contractor
The MMI, like when they're discharged at MMI? Yeah, definitely. Definitely. For sure.
You know, some subcontractors don't want to release it. It's a fight to get it, and you know, through the battle of getting it, sometimes you don't get it and you move on, and you know, it's hard to kind of keep that consistency up. So best practice is that we do get it all the time.
You have someone over here chiming in.
From a subcontract,
Yeah, from the sub.
unless it's an actual CSIP that, or OSIP that
Control the workers' comp.
you have no right to tell you.
See, that's what I hear. Yeah. So we have no right to it.
Private information.
So how do we make sure that worker is not being put in a precarious position to go back to work? How do we monitor that?
Just ask for a letter that says they're in compliance with anything that the release from the clinic.
Yeah, what are the restrictions, and then monitor it, right?
So once that worker goes to the clinic, we're pretty much hands off. We make sure that worker gets medical treatment, and then we're kind of hands off.
Yeah, unless you're the direct employer or you are providing the actual coverage. And unless you provide that coverage as, you know, a CSIP,
Yeah.
where a lot of us have been involved in that in the past, but otherwise we don't have a right to anybody else's health information and would violate HIPAA acts anyway.
So, and it's very tricky from the clinic side because we oftentimes, it's not clear if the person is coming from, is it a subcontractor? You know, so it's very tricky. So that information always goes to the supervisor that is identified to us when the person comes to us for the injury. So, but it's challenging on our end and we stick to that. But he's absolutely right. I mean, it depends on what the relationship is and is it actually your employee or not?
Thanks, Brian.
The best thing is on a CSIP,
Yeah.
just get with the clinic ahead of time and get with the director or the clinic manager and say, hey, we're providing the insurance. When we send somebody, we'll call you and let you know. They might not be our employee, but they're under our insurance.
Makes sense. Thank you.
So is it a recommendation or mandatory where a certain weight becomes two-man lift? What,
It's such a tricky question. One of the injuries, most of the injuries that we see aren't necessarily because somebody lifted something that was too heavy. It was that they lifted improperly. And the biggest problem that we see with two-man lifts, and they're obviously absolutely necessary, is that the two men aren't in sync when they're lifting. So we see a lot of injuries where one guy let go or they didn't lift at the same time. So we do a lot of pre-employment physicals with lift requirements, right? The maximum single lift on any client that in all the years that we've done this is 100 pounds. I've never seen anyone over 100 pounds. I would say anything over 50 pounds is probably pretty standard for most of our other clients, other than that one that has the 100-pound lifting requirement. FedEx has a 75-pound requirement. So
that's not OSHA regulated then, that's just.
Not as far as I know. No.
So in your practice, are you seeing more, or at least I'm observing more on our job sites, the female employees that are actually doing labor tasks, carrying heavy things and like that?
More and more.
Are you seeing more of that, right? The back
More and more.
injuries and things from the ladies out there?
Absolutely. Cement companies, asphalt
Concrete
companies.
contractors, yeah.
Yep. And they have, so obviously it's the same exact lifting requirement, climbing, carrying, depends. But yeah,
Seeing more of an uptick in female injuries?
we have for sure. Anyone else? Thank you.
Awesome. Gus, thank you so much. Appreciate it. That's why I try to do as little work as possible. So,
And the back feels great.
so thank you all very much for joining us today. As always, I want to remind you that these safety sessions are on YouTube. So take advantage, go to our YouTube channel. You can access our YouTube channel by looking up South Florida AGC in your search function in YouTube and make sure you subscribe. You can also, and I also invite you actually to go to our website, which is floridaagc.com, to check out what we've got going on in terms of events, when our next safety session is happening, which is easy, guys. It's the second Wednesday of each month. And any other information that you may need, including our upcoming events. Yes, sir. It is floridaagc.com. Thank you. You're very welcome. I needed to have our sign with our QR code. Vanessa's going to tell me that that's my fault, and it is, for not having it here today. But I want to thank you all for being here today. Today's Valentine's Day, Ash Wednesday, and Second Wednesday. So thank you all for starting your mornings off with us today. If you need anything from myself or Vanessa, please be sure to come up to us after the event. Hang out, grab some OJ and some coffee, and do a little bit more networking. No need to rush out. And thank you to all of you who joined us online. We appreciate you having us in your offices and being part of our community. Have a great day, everybody. Thank you.
Thank you.